And welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Nigeria does not have any active case of Ebola virus disease now. Now Lagos, where the scourge started, is free even of contacts. That is, people being watched because they came in contact with someone who had the disease. That's because the time needed to certify if there will be a breakout or new case has elapsed for everyone under surveillance. In Port Harcourt, at the last count, over 200 contacts were still under surveillance, but these numbers are coming down by the day. What is being reported in other countries, however, is dire by comparison. What should Nigeria do to maintain this success and to reduce the risk of outbreak of EVD and other diseases? With me on today's show is Dr. Olaniyi Ibidapo. Dr. Ibidapo is a public health consultant and CEO, Joe-Africom Sourcing and Services Limited. You're welcome to the show, sir.
Thank you for having me.
Nigeria is free. We don't have any active case, thank God for that. But apart from all the precautions we have been taking, should we be doing anything more?
Well, first of all, we all thank God for the fact that the last patient has been released this week. We need to maintain the status quo and do much more than we're doing now in terms of spreading the awareness on Ebola prevention. The government has done all the things that were necessary to be done. They responded with speed and forming the necessary committees and working together with all the stakeholders, particularly the World Health Organization, the American CDC, and the Ministry of Health has been so active in this. The MDAs also has been so much engaging in this campaign. So we need now to continue to spread the news in terms of what needs to be done and how we can actually stop the spread if eventually we have any occurrence.
When you say we need to do much more, are you talking about only in terms of awareness, making people aware of what Ebola virus disease is and what to do to make sure it doesn't happen, or are there other things?
For example, the research is going on now, particularly in the international community that has the resources. We haven't found a vaccine to cure Ebola at the moment. In the absence of that, we need to create awareness on what needs to be done. Thank God we have it in Nigeria through woman-to-woman transfer by importing this Ebola to Nigeria. It hasn't been investigated to be found that it was through any animal or contact with an animal. And the first way to reduce the spread is to limit the contact with any victim. And this will start with communication and spreading the news to the people in all the communities, down to the local and throughout to the grassroots.
Okay. Is there any likelihood? We have over 200 contacts, at least at the last count,
right,
in Port Harcourt. Is there any likelihood that any of these will become a case? Because I'm sure Nigerians have their fingers crossed and they're just counting the days, 1, 2, okay, we are free. But is it possible that we could actually see a case coming from these contacts?
Yeah, doctors will be able to confirm that researches are still going on, and as long as monitoring is still going on this patient. That's why they've not been released. That's why they've been restricted to be able to be monitored adequately before being released to their family. There are chances, clinically, the doctors will be able to confirm this. Medically, it could be possible. The doctors will be able to confirm, and if they prove that it could not spread, then they will release the patient.
People have said that waste disposal is very important when it comes to these diseases. What is your opinion of our waste disposal? Should we improve? Are there things we should do to make our waste disposal more effective and less likely to cause any of these problems?
Of course, yes, because hygiene is very important in preventing Ebola spread. And one of the ways that we can contact this is through also needle that has been used on Ebola victim. And that is why we have to be very, very active and very, very cautious about, disposing all the clinical waste and preventing the people that are working there and make sure that are adequately trained. Privately at homes, people also should take care of their waste adequately in terms of keeping them in a very protective area, so that if there's any way whereby animals can have contact with all these things, it will not spread to human beings.
You mentioned animals. Is that the method? From the waste to the animal to the human being? Is that really usually the mode of transmission?
It is a possibility, because Ebola started through animal to animal transfer. And we found out in Zaire, according to records, that it was through contact with the chimpanzee that the people there were able to have it, contacted it. In Nigeria, for example, we need to take precaution. Precaution is the word. So we need to take precaution in terms of making sure that we take care of our waste at home.
Okay, now I want to turn our attention to those people who have actually had Ebola and survived. They are now safe, they are now sound, but there's a problem of stigma. Is there anything medically that can be done for these people to help reintegration? Because a lot of people are afraid of them. They're afraid to come close, they're afraid to touch them. What can we do to help reintegration?
We cannot, talking about stigmatization, it is an attitude of discrimination towards a victim. You cannot treat that. You can also socially mobilize both the victim and the victimizer. What we need to do is to, first of all, create an awareness and let the people know that you cannot discriminate on somebody that has just gone through treatment and come out safe, because that will jeopardize the process that we are going through now. Because by people being afraid to come out, it might spread further, the Ebola disease in the community. So what we need to do is socially mobilize people to, to create awareness, to train people, and let also the government empower the victim in terms of supporting litigation, because any discrimination is against the human right of such Ebola victim.
Okay, you said it cannot be treated. This stigma cannot be treated. But what about the option of psychiatric help for people who may be feeling let down, or have a medical problem because they feel rejected?
It's not a psychiatric problem. It's an emotional issue. You need psychologists to be able to monitor and, kind of informed the victim about the importance also to stick out and also fight, for his right. It's not a psychiatric problem. It's a psychological problem in terms of the fact that this victim will be emotionally demoralized.
We've not had Ebola here before. This is the first time. But there are other countries where Ebola has occurred more than once. Congo, for example. Yeah. They seem to have episodes of this. Now that we have had an episode of the Ebola virus disease, is it going to be easy to get triggered off again in our society? Is it something that we should be on the lookout for? I mean, after we are cleared of this particular episode.
Yes, we have to be watchful, because you can't control migration. People move from one spot to the other. And we need to be careful in terms of, what the government is doing right now. For example, right now at the ports, there are monitoring units that, look at people that move into Nigeria by testing them and measuring their temperature. We need to continue in this process because we have not eradicated totally in West Africa. And as long as we cannot reduce or control migration, it has to be part of our system.